Hi, I'm Tim Wiedrich. I'm with the North Dakota Department of Health, Health Resources and Response Section. This is a press conference regarding the new coronavirus, or COVID-19 as it's often referred to. Joining me is Kirby Kruger, who's the Division Director for the Division of Disease Control. We'll be starting off with some brief opening comments to provide some background information and some current status information about the disease within the country and some of the international information that we have. And then we'll be moving into a session answering your questions. Right now, all of the telephones are muted in our bridge, and at the point in time when we arrive at the question and answer portion, we'll be taking questions both here in our location at the North Dakota Department of Health in Bismarck, and then also those that have called in by phone. You'll need to raise your hand if you're holding by phone by hitting star and then pound. That will then have your hand raised, and then as your turn comes up, we'll go ahead and open your mic so that you can, in fact, pose your question. So let me begin by turning it over to Kirby Kruger for some opening comments.
All right. Thanks, Tim, and good afternoon, everybody, and I appreciate your presence here today. The North Dakota Department of Health is continuing to work to identify COVID-19 within our state. The primary activity that we're undertaking to do that is to monitor people after they return from China. And the goal of this activity is to quickly identify infections and to then contain the virus as we identify it. Currently, there are no cases of COVID-19 in North Dakota, and nobody is being investigated or being tested for the virus at this time. We are currently monitoring 9 people who have recently returned from China, and that monitoring will continue for a 14-day period until they are completed, and at that point in time, we release them from the monitoring. I want to also add that the individuals that we are monitoring, they are voluntarily practicing social distancing, and they have been very cooperative in that endeavor. What they do is that they have agreed to limit their activities so that they're not going out into crowded areas or running into people, and basically keeping themselves at home as much as possible. So, as we have heard this last week, the CDC has indicated that the nation needs to prepare for a wider transmission of this virus. They expect that the virus will continue to spread, and so having heard that, we are now transitioning also into another phase of this. Although we still want to do the early identification and containment, we also need to start readying our state for community prevention, community level preventions. And I think one of the things about community level preventions is it's something that we do year in and year out. When we talk about influenza and preventing influenza. And some of the things that people can do to help prevent the spread of disease or help to protect themselves from disease include some of these things. Staying home when you're sick, practicing good respiratory etiquette, for example, coughing or sneezing into a Kleenex and then throwing that Kleenex away, or if you don't have a Kleenex, coughing or sneezing into the inside of your elbow, practicing good hygiene, frequent hand washing with soap and water, or frequent use of a hand sanitizer that contains a high level of alcohol, 65 to 95%, and then routinely cleaning frequently touched surfaces such as doorknobs. And then the one thing that we want to emphasize as well is that for people who are planning international travel, we encourage them to look at the CDC travel advisory website. Because right now, CDC has issued several travel advisories for different areas of the world. And so people planning international travel should look at that website and make their plans according to those travel advisories. Right now, there are level 3 warnings for 2 countries, China and South Korea. There's a level 2 advisory for Iran, Italy, and Japan, and a level 1 for Hong Kong. So all of these things are important for people to do to help protect themselves from getting ill, whether it's influenza or it's COVID-19. However, they also help slow down the spread of the virus, which is important for us from a public health perspective because if we can slow down the spread of the virus, it allows us more time to be able to prepare and to respond, and it also reduces the burden on our resources as the number of cases gets spread out over time instead of a bunch of cases occurring at one time. The risk for COVID-19 in North Dakota is low, but it's not zero. And I just want to say that right now, with that risk being low, I don't want to lose focus on a bigger risk right now for North Dakota, and that's influenza. Influenza continues to be spread throughout North Dakota. We are trending towards a record year for influenza cases being reported, and there's still vaccine available. And this is a disease where a vaccine can help prevent this disease. So we encourage people who haven't been vaccinated to be vaccinated. Tim, thank you.
Thanks, Kirby. So a few words, excuse me, about the level of preparedness that's occurring within our state. There's a coalition of public and private partners that have been formed for a length of time, going back to the beginning of some of the preparedness activities that began in 2002 in this state. We've prepared for a wide variety of emergencies, including large-scale transmission of communicable disease. And so while we don't have specifics for the coronavirus or the COVID-19, the all-hazards approach that we've taken has placed us in a strong position for response. So we have, as part of this specific preparation, we provided information to clinical personnel, such as physicians and nurses, about how to treat the disease. We have provided situational awareness to the rest of the response community, whether that's hospitals, physicians, nurses, EMTs, long-term care facilities, in terms of what this disease consists of and what's actually occurring as a result of the activities we've seen both internationally and now within the United States. We have actually a cache that we refer to as the North Dakota State Medical Cache that has a substantial amount of equipment in it that we reserve within this state for situations where we're no longer able to obtain things on the private sector distribution system. So things like masks and gowns are excuse me, within that medical cache. And so in anticipation of diseases such as this, we've done a distribution of personal protection equipment to hospitals that are called PAPRs. These are hoods with powered filtration systems that the hospitals possess so that when they encounter a patient that they can in fact have adequate protection. We also have reserves of those devices within our medical cache as well. There's also a significant number of masks and other appropriate equipment for the dealing with communicable disease. In addition to that, we've also planned transportation mechanisms. So if in fact we have someone that is positively identified and needs to be transported to a tertiary care center, one of the larger medical facilities, we've made arrangements with certain ambulance services to both train and equip them with the appropriate precautions and equipment that's necessary for doing that type of a transport. And additionally, we've moved forward with preparing 911 systems, so if in fact we begin to see the disease within North Dakota, that we can take adequate steps to inform EMS providers by having dispatchers ask the appropriate questions to identify potential cases as part of the 911 system. So those are just some of the steps that have been taken as we move this process forward. Well, I think we're at a point now where we're ready to move into the question and answer period. Let me just quickly remind you that if you're on the telephone, we're going to ask that you press star and then pound. That will show on our control board that you're raising your hand, and we'll open the microphone and indicate to you when you can go ahead and ask your question. For those in the room, if you could just raise your hand so that we can, in fact, acknowledge you and then proceed with your questions. Do we have any questions? Yes, ma'am.
How large is the effort to tackle COVID-19? Like how many departments are involved, people around the state? Is this just the capital that's built working on this, or is it a statewide effort?
Kirby, do you want to begin?
Yeah, I'll begin. So this certainly is a statewide effort, and I think early on in this effort, the important players that we identified were our local public health units and then our medical providers, because they're at the front side of this, and we needed to make sure that our medical providers knew what to look for in terms of the risk that people might present with and the symptoms that they should look for. But the other part of this was making sure that they understood what types of precautions they needed to take, not only to protect themselves as they were evaluating patients, but to protect other patients that may be in their facility. So those were our two early partners. Now there's other partners that we will continue to be working with in the near future, and I'll let Tim talk a little bit more about that.
So as we've begun these preparations, we moved into what we call an incident command process. And that's really a way that we pull the department's activities together in kind of a central way to coordinate all of the activities. And for the current operating period that we're operating in this week, we're going to begin doing outreach into certain sectors such as education, K through 12 and higher education, such as corrections, such as the business and religious communities, and then of course the medical providers will continue with. So those activities in terms of planning those processes are underway as we speak, and we'll have more information about how that will actually take form as this process moves forward. Now remember, we're not creating a plan at this point. We have a plan, but what we're doing is basically refreshing people in the information that was previously created for part of the plan, and then making whatever modifications need to be made regarding this specific disease. Any other questions? Go ahead.
I'm very curious. It was briefly referred to as a treatment. So somebody contracts COVID-19. How do you treat it?
Okay, so that's a good question. And the question is what's the treatment for COVID-19? And there is no specific treatment for COVID-19. The treatment is largely supportive. In other words, supporting the individual's symptoms and making sure that they are, for example, remain hydrated and all their systems are functioning properly. But right now, there is no specific treatment for this. There are clinical trials that are underway to test different antiviral medications, but there is nothing that's been available that has been proven. So
as a follow-up, then the point is an ounce of prevention is worth a pound of cure.
thank you. Yes, the point is an ounce of prevention is worth a pound of cure, and that is a great public health slogan. So.
Yeah, and so just to reiterate, so what we can do right now is just making sure that we're keeping our hands washed, that we're not touching our face after contaminating our hands with something so that we're spreading the disease that way, limiting our contacts in terms of handshaking and those types of steps. I'm also wondering, Kirby, would you just expand a little bit in terms of a lot of conversation has happened over the public's use of face masks, and would you expand on that a little bit?
Sure, and it's a common question, and I think the public is rightfully, asking, do I need to wear a face mask or not? Because they see a lot of that on the media. From our perspective, I don't think there's any good science to support that a face mask is going to protect somebody any more than taking these other measures that we've talked about. Ideally, when what we see in the healthcare setting is, and what we recommend, is that a surgical mask can be used to put on a person who has COVID-19 or other respiratory infection to help prevent the spread of that virus from that person. But in terms of protecting people, a face mask, we're not recommending a face mask.
Thank you. Other questions? Yes, ma'am.
So what are numbers like for recovery, I guess? Like if anybody's been diagnosed with coronavirus and they've received that, I mean, not necessarily a treatment for coronavirus, but symptom care, what does recovery look like?
Sure. I think that there's a couple things to look at here, and one is that the recovery rate varies a little bit whether the person is in China or outside of China, because what we're seeing is a little bit higher case fatality rate in China than outside of China, and so what we're seeing is that about 99% of people outside of China are going to recover. So it's got a fairly low. It's somewhere that's probably somewhere around the 2.5% fatality. But again, that's changing and evolving, and we're early in the outbreak, and so that may change, but that's sort of what's being reported right now, so.
At, at the state level, you guys are the ones people go to for answers, but who do you guys go to for your answers? At the national level, CDC, who are you guys getting your information from?
So yeah, I'll just start here. From a disease control perspective, CDC is our main source for information. They're the ones who are able to funnel all the information they're gathering from throughout the United States and from the World Health Organization and from the other countries and make some meaningful use out of that. And so they're the ones who have the information on a wider range than what we do. And so when they have that data, they can make the best decisions possible and make the recommendations that they make. So.
And then there are other federal partners as well. Within the CDC, there's a branch for preparedness, and so much of the activity that we deal with on the preparedness side comes from that branch within the Centers for Disease Control. Health and Human Services also has a branch that deals with EMS and hospitals and long-term care, and so we have relationships and communications with them as well. And then other states in terms of making sure that we're aware situationally about what's going on. There's been a lot of communication that's been flowing. In fact, I would say that it happens daily. At some level, we're having communication with federal or other state partners on an ongoing basis regarding this disease.
What about hospitals? Have you guys been in contact with not only local hospitals, but hospitals around the state into what, how to prepare in the case it does reach the state of North Dakota?
Yes, we actually did an early on reach to hospitals, and so about 3 weeks ago, we produced and did an interactive session with hospitals so that all the hospitals across the entire state, all of public health, long-term care, emergency managers, and other medical providers could join in that conversation. And we really targeted several things. One is to give a situational awareness about what was actually happening at that time. But in addition to that, we brought in a clinician and walked through the specific clinical treatment and care protocols that are associated with this disease. And we then moved into things like how does reporting occur, how do we do infection control, and also had some conversation about the transportation mechanisms. In other words, we did an overarching review of the process.
So, and just to add to that, we've done 4 communications with healthcare providers through a system that Tim's group has established. It's called the Health Alert Network. And so what we can do is we can issue guidance to providers through that network, and we've done that 4 times now during this event. So.
Yes, ma'am.
So how responsive would you say North Dakota is compared to other states in dealing with COVID-19?
Well, I'll go ahead and tackle that. I think that all of the states have varying levels of preparedness, but we're united in terms of how our approaches exist. So going all the way back for the last almost 2 decades now, we recognized there needed to be a national process to move public health and medical in large responses. And so that's what came as a result of the September 11th attacks. And the aftermath of that was the organization into the types of systems that we're utilizing as part of this process. So while each state's going to have its unique challenges, we really can function as a united team, knowing what the other states have, what they're going through, passing that information between states and up through the federal government as well.
Is there a specific illness, virus, disease from the past that you would compare this epidemic to?
Well, I think you can make some comparisons, but I don't think you can make anything. There's nothing totally analogous out there that I can compare to. Since 2003, this is the 3rd coronavirus that has emerged that was previously unrecognized to cause human disease. The first one was SARS, then the second one was MERS, and now we have this one which causes COVID-19. And all of them have been a little bit unique in how they presented themselves. And then in 2009, we had a brand new influenza virus that emerged, and so we learned a lot of lessons from that as well. And so while those events are important for us to take some lessons away from, they don't necessarily 100% help us to predict what's going to happen with this virus. And so I think the idea is that this virus is going to, as it emerges, it will do what it does, and we just need to be prepared to work with it. So.
Yes.
A question from Facebook from Jeremy with Forum News Service. His question is, are the 9 people that we're currently monitoring the same or different people as the 10 that we were monitoring earlier in the month?
Oh, okay. So that's a good question, and because I'm not doing the monitoring personally myself, I'm not going to be able to answer specifically. But let me give you an idea of what the process is. So we've monitored a total of 15 individuals now in the United States that have either completed monitoring or currently being monitored, and some of them have dropped off. And so by and large, part of the 9 that are currently being monitored, some of them probably are part of that original 10. I know that within the next couple days, we're going to have quite a few individuals who complete their 14-day monitoring period. I don't know what that exact number is, so we expect that the number that we're going to be monitoring next week will be less. So.
But at any point in time, there's going to be a carryover of when the cycle of 14 days is starting.
Right.
And so that's why that number is in flux. And what we're attempting to report is just how many are in the current status.
Right. How many have entered it and complete, and then how many are currently. Yep. So, and the other part of this is that as individuals continue to return from China and they're allowed to go on to their final destination, if that final destination is North Dakota, we will be notified of those individuals, and then they will then go into the monitoring process. So.
To the front, please.
Okay. Can you explain the monitoring process? How does it, how do you reach out to them? How do you continue to monitor them?
So I think the monitoring process is fairly simple. Is when they arrive in North Dakota, we do have information so that we can contact them. We do reach out to them. That initial contact, we do a risk assessment to help us understand more what their risk may be for having a COVID-19 infection. And then we will provide them with some materials so that they can monitor their temperatures twice a day. We ask them to take their temperatures twice a day and ask them to report to us if they have an elevated temperature or if they develop some respiratory symptoms that we may be interested in. And we give them a list of symptoms they should watch for. And because it is active monitoring, we actually reach out to them on a daily basis. And whether that's a phone call or a text or an email, there's a communication that occurs on a daily basis with these individuals. And in that communication, we actually gather what their temperatures are for that day and what symptoms they may have developed.
So what does Outlook look like? How long do you expect to have to monitor people coming in to the state? And can you repeat the questions for the
Oh, yes. Okay. So the question, I think, is how long do we expect this monitoring to have to go on? And from our perspective, the monitoring will probably continue as long as the United States and North Dakota is in a where our main response is still trying to contain the virus, identify early and contain. I think once a community-wide transmission starts occurring, then monitoring probably becomes a moot point, So, and so as long as travelers are arriving from China and we're getting notifications, we'll continue to monitor, so.
All right. Well, I believe that we have completed our question and answer period. I do want to thank everyone for attending this, and please don't hesitate to reach out for more information to the North Dakota Department of Health. Let me just do one last check to see if anybody on the telephone would like to ask a question. The way you raise your hand is by hitting star and pound on your microphone, and I'm sorry, on your telephone. And so we'll wait just a moment to see if we have any last-minute telephone questions. And it doesn't appear that we do, so thank you so much. Take care.